Assalamu alaikum. I am Dr. Shabana Maqbool. I am lecturer in Department of Community Medicine, GMC Srinagar. Today I am going to discuss topic acute respiratory tract infections. In this topic we will be discussing following learning objectives. First of all, introduction of acute respiratory tract infections, epidemiological determinants, mode of transmission, clinical assessment, classification of illness, treatment, and then how can we prevent acute respiratory tract infections. Acute respiratory tract infection causes actually inflammation of respiratory tract from nose to alveoli, anywhere. It can be classified depending on the site as acute upper respiratory tract infections and acute lower respiratory tract infections. Upper respiratory tract infections include acute rhinitis, what is commonly called as common cold, acute tonsillitis, that is infection or inflammation of tonsils, pharyngitis, inflammation of pharyngitis, then infection of middle ear otitis media, acute otitis media. Then second category is acute lower respiratory tract infections, that are infection of epiglottis, epiglottitis, laryngitis, laryngotracheitis, infection of bronchitis, infection of bronchioles, bronchiolitis, and then last infection of alveoli, which causes pneumonia. Now, what is the burden of acute respiratory tract infection? As the picture depicts, pie chart which shows the burden of acute respiratory infection among neonates. As it is shown, pneumonia constitutes about 19% of infections in neonates among all other infections. Diarrhea constitutes about 17%. Neonatal infections, other neonatal infections about 10%. Malaria constitutes 8%. Measles 4%, other injuries 3%. Now let us discuss epidemiological determinants of acute respiratory tract infections. What are various agent factors? There are numerous bacteria and viruses and other infectious agents which cause acute respiratory tract infection. Severity of illness is usually determined by secondary bacterial infections, if they occur. Now the slide shows various bacterial agents which involve various ages, from infant, young children, usually under 5-year children, or adults, involving different sites of respiratory tract, from upper respiratory tract to lower respiratory tract infections like common cold, pharyngitis, laryngitis, pneumonia. Various infectious agents are Bordetella, Corynebacterium diphtheria, streptococcal pneumonia, staphylococcal pneumonia, Haemophilus influenza, commonly Klebsiella, Legionella. Now, what are various viral agents which cause the respiratory tract infection? Again, adenovirus, epidemic types, influenza, parainfluenza, respiratory syncytial virus, very common cause in infants and young children, rhinovirus, coronavirus, like corona pandemic involving mostly and commonly respiratory tract infection, measles in young children. Now the picture shows various types of viruses and the sites of respiratory tract causing different types of pneumonia, like sinus, involvement of sinus causes sinusitis, involvement of pharyngitis, infection of larynx, bronchi causing bronchiolitis or bronchitis, then ultimately alveoli causing pneumonia. Now, what are the various host factors? Very important in India, as it is an underdeveloped country. Malnutrition and low birth weight is a major problem. Rate of acute respiratory tract infection is highest among those children who are malnourished or whose birth are low at the time of whose birth weight is low at the time of birth. Case fatality rates are higher in young infants and again in malnourished children. Pharyngitis and otitis media increase from infancy to 5 years of age. So, what are various risk factors? Very important. Climatic conditions. Usually, winter favors the condition. Acute respiratory tract infections are very common and in increasing level during winters. Housing conditions. Substandard condition of housing. Hygiene, poor hygiene. Socioeconomic development. Again, poor socioeconomic status favors the respiratory tract infections, overcrowded dwellings, poor nutrition, low birth weight, intense indoor smoke pollution. What is the mode of transmission? Again, direct contact, person to person contact. Route is again airborne route. How can we assess a child with acute respiratory tract infection? Usually the age of child is first detected. Since how long child is coughing, what is the time since coughing, how long child is not feeding, child is not able to drink properly, what is the time since fever is there or not, child is excessively drowsy or child is difficult to wake. Look for irregular breathing, look for convulsions, whether child is turning blue. Then physical examination. Child is seen for full 1 minute. Looking for abdominal movements or lower chest when child is calm. Then child is looked for fast breathing. In a child of 2 months, less than 2 months, fast breathing means 60 breaths or more. Child 2 months to 1 year, fast breathing means 50 breaths or more. Child 1 to 5 years, fast breathing means 40 breaths or more. Then look for indrawing of chest if chest wall goes in when child breathes in. It occurs when child puts efforts for breathing greater than normal. Then look for stridor. What is stridor? Stridor means harsh noise when child breathes in. It occurs because of narrowing of larynx, trachea, epiglottis, which interferes with air entering into lungs. This condition is called croup, which is common in pertussis. Then look for wheeze. What is wheeze? Wheezing is a soft whistling noise when child breathes out. Again caused by the narrowing of air passages in lungs. Breathing out phase takes longer than normal and puts an effort. Take the previous history of wheezing. If so, child is classified as having recurrent wheezing. Then, what are the other signs? Child is sleepy abnormally, very difficult to wake. Feel for fever, Measure body temperature. Look for cyanosis, which is a sign of hypoxia, which must be checked in a good light. Then check for severe malnutrition, which is a high risk factor for acute respiratory tract infection. Case fatality rates are high among these children who are severely malnourished. These children need careful evaluation and management for pneumonia. Then, how can we classify the illness? In a child aged 2 months to 5 years, pneumonia is classified as very severe disease, severe pneumonia, pneumonia, no pneumonia. Again, in infants less than 2 months of age, pneumonia classified as very severe pneumonia, and pneumonia. Now we discuss in detail how can we assess the child aged 2 months to 5 years. First, very severe disease. Signs are child is not able to drink, child convulses, child abnormally sleepy, not able to wake, child has stridor in a calm position and is severely malnourished. What is the treatment? Child should be given first dose of antibiotic and some antipyretics for fever. If child is having some cerebral malaria, anti-malaria drugs are given. Child is referred to higher center urgently for proper management. Then severe pneumonia. Signs of severe pneumonia are chest indrawing, which we discussed in early slides. Recurrent wheezing. What is the treatment? Again, first dose of antibiotic is given to child. Fever is treated. And child is referred to higher center for proper management. If referral is not feasible, immediately treat with antibiotics and follow closely. Then pneumonia. Signs of pneumonia are fast breathing and there is no indrawing of chest. What is the treatment? Advice is given to mother about the home care and an antibiotic is given and outdoor antibiotic is given. Fever is again treated, wheezing treated. Mother is given advice about the danger signs if they appear in the child or child's condition getting worsened, then child has to be returned back to hospital after 2 days for reassessment. If child's condition get worse, then return immediately. Again reassessment. Child is reassessed for these signs and symptoms after 2 days. If condition of child is worse, that means he is not able to drink, child has chest indrawing, fever high grade, refer urgently to hospital or change antibiotic or refer after 5 days of hospital antibiotic if child's condition get worse. Then we discuss acute respiratory. How will we assess the infant with acute respiratory tract infection less than 2 years? First, again, very severe pneumonia. What are the signs? Child stops feeding, child convulses, abnormally sleepy, child has stridor, wheezing, hypothermia and fever. Again treatment, child should be kept warm and referred urgently to higher authority after giving first dose of antibiotic. Then severe pneumonia. Again, the signs of severe pneumonia are severe chest indrawing, fast breathing, that is 60 breaths per minute or more. What is treatment? Child should be kept warm. Again, first dose of antibiotic and refer to higher authority for proper management. Then, no pneumonia means simple cough or cold. What are signs? There is no chest indrawing, no fast breathing. Child has simple cough or cold, mild fever. What is the treatment? Again, mother is given advice about home care of an infant or child. Again, young infant should be kept warm, breastfeeding continuously, frequently, clear nose if it interfere with breathing and feeding. Return child again to hospital if there are any danger signs. That means breathing difficult, child is not feeding properly, child has difficulty in drinking, not able to wake up, sleepy, drowsy, or becomes sicker, more and more sick. Then there are some treatment modalities of pneumonia according to age groups and according to dosage schedule. Again, treatment for severe pneumonia, either ampicillin or chloramphenicol benzyl penicillin is given in a proper dosage according to condition of a child. Again, treatment of severe pneumonia, there is no improvement. If there is no improvement, then for next 48 hours change antibiotic or monitor for fluids, food intake, advise mother on home management or on discharge. Treatment for infants less than 2 months, antibiotic dose frequency in age, frequency for 7 days to 2 months, injection ampicillin, gentamicin or benzyl penicillin in a proper dosage schedule. Management of acute upper respiratory tract infections usually don't need treatment with antibiotics. Acute upper respiratory tract includes acute sinusitis, cold, pharyngitis, because causative agents are usually viruses. Symptomatic treatment and care at home is enough. What's the prevention of acute respiratory tract infections? There is a control program which is a part of reproductive and child health care program. Improvement in the living conditions, improvement in the housing conditions, better nutrition of a child, exclusive breastfeeding, proper weaning, reduction of smoke pollution indoors, better maternal child health care means better care at the time of pregnancy, better antenatal care when child is cared at the when a pregnant woman gets proper nutrition during the antenatal period, child is healthy. Proper nutrition at on time, various health promotional activities, early diagnosis and treatment is very important for prevention of acute respiratory tract infections. Immunization for measles is available in universal immunization programs. Hepatitis B vaccine, pneumococcal pneumonia vaccines at proper age group are very important for preventing the acute respiratory tract infections. Thank you.